100%. But I think, you know, going forward, we will be working really closely with Robbie Urban and more work with Jack Gould and John, just to look at what the art of the possible. But for that, yeah, I think we've really got a lot to do.
Okay.
Yeah.
Right. Well, yes. Okay. So a recommendation is just to maybe a bit more understanding on what you're landing. That would be really helpful because obviously I know this is budget, but it helps us really sort of in the MTFS as well ask those questions as we go forward. So that would be great. Thank you very much. And that is everything that I had on budget. So I'm just going to look round and hope that my fellow councillors have asked all the questions they wanted to ask this evening. Yes, on budget. Okay, so thank you very much for coming this evening. It has gone over again. I was trying to speed you all up, but budget is budget and it's huge. So huge in the wrong direction, I suppose. But anyway, so thank you very much. But the rest of the panel's got a few more couple of items to go through. So Dominic, you want to come and quickly talk us through? So we have next on the agenda. There you go. So it's agenda item 9. Oh, we're doing the tracker. So we're doing the tracker. Excellent. Thank you. Right. So going back to Becca, which is probably agenda item maybe 7.
Yeah, so just to take you through some of the updates from there. So apologies you didn't receive this in advance. But going back to the first one to just draw your attention to is number 3A, which is if you go back a couple of pages, it's on over 2 pages, but that goes back to the June meeting. So that was originally, we wanted a breakdown of the number of physical mental conditions in younger adults with a care package in the with particular reference to the 50 to 64 age group, and we received some graphs on that, but the graphs were only showed the 18 to 64 age group, and this was something that came up tonight actually. And basically we asked for a more detailed breakdown, and they sort of have basically explained that they don't collect the data in that way. So again, because this came up as a live issue today about having this breakdown of why the sort of younger age group is being so I think that they've said that going forward they can provide a more detailed financial deep dive, but at the moment that's not data that they collect. So I think that's just one to look at as that came up tonight. All of the other updates are from the most recent meeting, so that's the first couple of pages. The most relevant to draw your attention to is number 7, which is on the back of the first page, and that's the query that I think was from Helena, which was about reablement. And we've had a detailed response come back about the reablement model, and that's basically explained. I can pause if you want to read it in more detail, but it basically just says that their external consultancy 3110 has done a detailed review of the reablement service, and that will be that outlines the strength of the service, areas for development, and started exploring options for the future. And Joe has suggested that bringing an update to the panel, a full report to our meeting in February. So that's an option for when we come to the work programme item. The other ones are relatively straightforward. Number 8, this was when we had the finance update, and there were various graphs on service users and age cohorts. And we asked why only certain ones had been selected, and it was basically came back that they'd picked sort of some selected most relevant ones, but we can request more additional data if we want. So the action there is really if there's anything else you want to see on that, then let us know and we will ask for it. Number 9 was just saying that was following up that we wanted more detailed information about the progress of savings requests in previous years. So we'll follow that up when we have the next finance update. 10 and 11 were just very straightforward ones about just passing on some contact information. So I think it was to add the Tottenham Pensioners Group to the JPB stakeholders. And then there was also the issue of the Transport Inclusion Group coming up as part of the joint partnership board discussion, and that's been passed over to the Community Safety and Environment Scrutiny panel because that sits under their remit. And the last one is number 12, which was we wanted a scrutiny review on communication with residents, and the terms of reference for that and the scoping document is in your agenda pack as another agenda item tonight.
Dominic, that's a really quick whip through. I think we had, that's a Donovan's question around the update on the last meeting from memory. One of the actions was you asked what we were doing in relation to the discharge from hospital thing. And Dominic, I think do you want to just very quickly tell the panel what we've been doing to try and get this eventually through the finish line here?
So we've had actually a number of discussions that the chair has been supporting. We had one with Joe and one with Jess Leavesley, who's in the Mental Health Trust. That was about assertive outreach. That's right. I wasn't at that one, but that was the assertive outreach for mental health and medication. And then there was a final session that we had with Claire Henderson yesterday, which was about localities and hospital discharge. So when we've got the write-ups of all that, I'll send that round, and then we'll add basically the details of that to the report. The aim is to get the reports to our next meeting on the 16th of December. So you'll all need to have a look at the draft reports. I guess that'll be around about end of November, beginning of December. And then.
Did you say you were going emailed or you're going to email it?
Will do.
Yeah, because we've just had the last session that we had was yesterday. So
okay, because there's things like there's a couple of hyperlinks, and it also mentions in number 6 it mentions attachment A, which presumably would be attached to your email.
Yes, so I'll send this around by email. So basically, we build up the attachments through the year, sort of thing. So I don't always include them all in the pack, but yes, I can do that. I did actually speak to. So attachment A was circulated originally. This was the details of the appointment procedure, because I think that was updated at the beginning of the year. And then the other issue was the next recruitment process. So I think there was the question about how we were going to fill those vacancies. And I spoke to the Democratic Services Manager about that, and I was explaining that would basically begin at the next beginning of the next municipal year. So it's a once a year process, the sort of active recruitment part. So after the local elections, there will be a sort of a call out for members that will be through the various sort of voluntary sector networks, I would imagine. I can recirculate attachment A though about the process.
Okay. I suppose if we're going to be calling out to community groups, might be better to do it before the election, because I said we'd want to start, or whoever's here would want to start these meetings, quite soon after May. Yeah. But then they'd obviously need a lag in times of them discussing in the organisation. So whenever the new body is approved, the new adult health, then they will have a list of people who will want to be. So that's what I'm saying. Maybe start the process before May.
Yes. Yeah. I mean, I'll pass it on to the Democratic Services Manager. I mean, I think, generally, I think there is, when we get to the sort of middle of March, end of March, we're not going to have a huge amount to do, because we're not going to have any meetings for a short while. So I imagine that's when we'll start. Focusing on, because there'll be a lot of things to prepare, inductions for the new councillors, for example. So there will be a lot of those sort of conversations going on about how we start the whole process up again. I'm sure Aisha's got planning ahead about the schedule for that, but I haven't had detailed discussions with her about that yet.
Okay, thanks.
Okay, so that was okay.
My one is just going back to item number 8. I think just to have a more like for like. They had one graph that was showing a particular age cohort, another one that was a different one. So I think if in future, if we have items, have it like for like, so have 18 to 54 and the same thing for 65 plus.
Yeah.
That's the same to compare it properly.
Thank you. That's
Suggestion forward.
We can actually go back and specifically what we want. That's good. I think the rest of it chance for you to read at home, hopefully. And then we've got one last final bit is around the current project that we're looking at, communication with residents. So I think this is going to be, so Dominic has written it all up in the pack. So I'm hoping this was bit round to everybody. So has anyone got anything that they have got any concerns about, they want to change, they want to add to?
Just to note, there were 2 pieces of feedback when we originally circulated, and those have
Yes.
been incorporated in the
Yeah.
in the proposed version.
Brilliant. And bearing in mind, we don't have an enormous amount of time to do this piece, but actually it's coming at a really good time because there's a huge push to improve communications and information to residents in adult social care at the moment. So the council's really looking at this as one of the areas of improvement. So I think this is,
Oh, no, I'll take it back. Sorry.
okay, good. I'm glad it's all good. So I think this is I think we're pushing it an open door at the moment to try and really improve this in a way that we probably haven't been able to improve it previously. So if anyone's got any further suggestions. So Dominic, what happens next now with this? This one's going.
Yeah, so if everybody's happy to approve that scoping document as the final version, and that will go to the Overview and Scrutiny Committee. So the agenda papers have been published next week, and the meeting is on the 27th of November. So then the OSC can approve that. We've already been in conversations with the Joint Partnership Board and Disability Action Haringey about setting up some meetings. They're happy to do that in December. The Joint Partnership Board has said that this has been an issue that's really important to a lot of their working groups, so they're happy to be involved in that. We just need to have the conversation about how best to do that and get those sessions going. But yeah, December and January will be the main evidence gathering stage, and then we can approve our final recommendations in February. And then the final cut-off will be the Overview and Scrutiny Committee on the 11th of March, which will be the last scrutiny meeting of the year. Obviously, OSC has to sign it off. So
we have to approve. Yeah.
Yes.
Okay, good, because otherwise it wouldn't have gone through and then we'd have been hard on that. So that wouldn't be good. So there's only the work programme itself left to look at tonight. So this is on page 87, which is agenda item 9. So we've got one thing to add into the 16th of December. So we've got 4 separate agenda items on that.
I think so. I haven't got it in front of me, but yeah, I think that's
Local
right.
government, social care, ombudsman, community health care, equipment supplies, safeguarding, and we had
and it's whether we have space to do Q2 finance as well in that. It may need to be a shorter item. The reablement piece be February, I think it was suggested, but February is, as you'll see, already overloaded. I mean, those are all sort of provisional or possible items, really. We will need to trim them down to 3 or 4 at most. So Joe suggested reablement. There's a number of issues. Most of those were sort of follow-up things, like the sort of health and wellbeing strategy. We sort of looked at it about 18 months ago, and we said, oh well, let's look at this again in a couple of years. So that's why that's in there. But obviously, we're not going to be able to do all of those items in February. But so it's if there's anyone preferences that people want to prioritise, then obviously let us know. There will be an agenda planning meeting involving the chair and the senior officers before then.
Okay, so this is for you to note if there's anything you want. I mean, I wish we had another 20 meetings we could fit. We've got an enormous list of things that we could do. That's the problem.
Huge, right?
We could literally be doing one a week. And we would only, I'm not sure we get through the list.
There's a lot of things on that list that have been done before, including the ones in February, but it's about wanting to do that regular follow-up like we've done for aids and adaptations, but it's obviously,
How we do it.
do that with everything.
The rules around the number of meetings we have a year. Do we agree on them in this committee, or are they just rules that? But obviously, dependent on very much dependent on one individual, right?
No, it's under our terms of reference.
Yeah,
isn't it?
what is our terms of reference? What did it say? 6,
5 meetings per panel, one of
5 meetings.
five formal meetings per panel, one of which is for budget, and then obviously review.
4 plus 1. Is it?
You can do an extraordinary meeting if something absolutely critical came up and we as a panel thought, right, we absolutely have to do this, but then we'd have to have sign off because it'd have to be okay by the OSC, but also its financial implications because it's officer time and,
Yeah.
it's officer time from officers.
Is that thing a tiny weeny thing that we can shove on somewhere, or is it going to be too big?
Well, we've got 4 agenda items for December and 4 or 5 for February. So we can, but we'll have to knock something else off.
Yeah.
So,
My one is just item for the work program,
mhm.
because obviously you're having the merger of the 2 ICBs. I think from my understanding is that you're aiming to have that completed by April. That's when the merger will take place, so like a future item, you just see the outcome of it that you can add as part of it.
Yeah, absolutely. Yeah. I'm sure that's come up at the JOSC as well. Recently, I've not.
So it is coming up at the JOSC. I've literally this afternoon accepted an invitation to discuss with the chair of so we're NCL and it's the Northwest. To have a high level meeting with myself, the chair and officers in the room about the ICB merger and how that's going to affect JOSC, and then coming down from that. So I haven't got a date for that because it literally just said yes. I'll send me the dates, and obviously we'll go along to that. So we're discussing it at the JOBS, the Joint Health Overview and Scrutiny Committee. Happy to bring it here.
Just, there's so much happening.
Yeah.
It's just an impact. I see a later item as part of the program.
So I think what I'm going to say at the moment as well is that it's what I'm struggling with, and I chair the JOSC, is understanding how the neighbourhood system, which is basically the localities team working from an ICB level, is interacting well with the council's locality teams, because we've got locality teams and they've got neighbourhood teams, and it's just how these 2 teams are actually going to work in practice. Because again, the concern is there's overlap. We're doing things, they're doing things, we're not talking to each other. So I'm trying to work out how that's happening at the moment, and that's conversation that we're having at JOSC next Friday. I'm trying to unpick that. But you're right, then that's a whole nother level on top of it.
Will you update us then? On the
Absolutely.
16th
So
of
can you put
December?
that in?
Maybe just an update.
Can you write that in, Dominic? And I'll definitely give you an update on that, because I've been struggling with this now for some time, trying to work out. So I've got it on the JOSC agenda, because then we can talk about it with, lots of people in the room, and hopefully they'll come and give us some better understanding of what they're supposed to be doing, what we're supposed to be doing, how it's all supposed to be working. But yeah. Actually, if I do it as a little written report, that will be helpful, because then you can read it and then ask questions that you want to once you've read it, rather than me just speak to you and then you're like, what was that? So, okay, anything else?
Did you want to mention these?
Do you want to mention those? Because let's give you the.
Okay, well, there's 2 events next week on Tuesday and Thursday, and they both relate to stuff that we've discussed here. One is the Carers' Rights Day and the launch of our new carer strategy. And I think if you go onto the agenda pack for the cabinet in the last week or so, that will have the new carer strategy. So this is a day for carers, people who are being cared for, counsellors, everyone to both celebrate carers but also launch it. And it's at Alexander Palace, the Creativity Pavilion, on Thursday from 10:30 until 4 o'clock. So drop in at any time if you can. The other thing, and this is again something we discussed, which was how people who are living with hoarding, either the people themselves or their relatives, can deal with that. And this is a meeting organised by the safeguarding team, because next week is safeguarding week, and that's going to be at Bruce Castle Museum, and that's on the Tuesday from 1 o'clock until 4 o'clock. And I think this is when we discussed it, it was something that I think is really important, and it's a hidden problem for a lot of people. And I think this is going to be, again, people that are either hoard themselves, living with hoarding, or their relatives, plus professionals, to talk about what our strategy should be. And maybe we should have a strategy, so when relatives are worried about they've got a relative they're worried about, or a friend they're worried about, or a person themselves have got an awareness something's going wrong, there's going to be a clear way that they can get help.
So we were talking about, with Claire, about discharge from hospital, and hoarding came up. So I asked Councillor Donovan if he's got any learning from when he goes to this event, if he could let Dominic know, and we can put that into our report, or not report, our project for discharge from hospital,
Yeah.
because that was coming up. They thought that was an area that they found it very hard to discharge people back from hospital because of the
So they visit
implications.
the home and then find the home
Yeah.
unsuitable.
And then it's people are stuck in that system again. So they were talking about this. So when Councillor Donovan told me he was going to this, I said, great, can you report back to Dominic? So I've given him even more work to do. So it is now committed to 10 o'clock. So I'm probably, I don't know what time it is actually.
1 minute too.
Oh, right, 1 minute. In which case, thank you very
21:59.
much, everyone. I'm going to close the meeting. Thank you.
That's the day that you and I go to.
I know, that's why I said I think that's
Yeah,
why
yeah.
Sean's doing it.
Yeah, you're good for that important meeting, aren't
Yeah.
you? The audit and.
Audit and scrutiny both together, yeah.
Yes,
Okay.
how it works.
You're the vice chair.
The vice chair, Earl can't go, so he asked me to go instead.
I am